in the nursing home setting, a lot of times there's people that can't tolerate a lot of activity and they need to build up their endurance. It's great for that. It's great for coordinating as far as both sides of the body. There's a ton of benefits, but this is Miss Ethel Hero. She's a wonderful lady. She had had a stroke, and a lot of times if you've had a stroke, you can't focus on the left side of your body if that's your weaker side. So that was very difficult for her. I'm bragging on you. Smile. Good. And what the Quadriciser's done for her is we're using it to get both sides of her body coordinated, and it's had dramatic results for her. She's actually two things. One is she's starting to get muscle contractures and starting to get contractions and starting to use the left side, her left arm now, which we're building on with other things. But really importantly, it's shown her where the left side is. We've been doing P&F patterns and also a pattern like this where she holds on to her other hand. Where before she didn't even recognize it was there, she'll actually take her left arm now and pull it into the center. She's starting to use her left arm. She before would never cross her legs because it was almost like she didn't have a left side, and she'll sit in her chair and cross her legs in the chair. So her body is recognizing it has the other side as well. It's also helped as far as getting everything moving on the left. It's helping with her eating. That's a big deal. If you don't recognize you have the left side of your body, it's hard to eat. It's helped just across the board with her. Transfers, it's been wonderful for us. And it'd be very difficult for Miss Hero to have just gotten up and moved her body like the machine makes her move, because it was so weak that she couldn't have replicated this anyway. There's nothing she could have done to do this same movement. People that have been told they've plateaued with other things, a lot of times you can't get this movement any other way. The therapist can't sit and move someone's arms and legs in this pattern. And so there are a lot of people that are told that they've plateaued when really it's just they don't have the device to be able to get them beyond that hump, so to speak, and get on to the next thing that they can do. So it's great for people that you think, well, there's really nothing we can do. It really gets them moving. It also helps with alertness. People are much more alert when you do it, and that alone is a benefit as far as trying to get out of bed or feed themselves or getting a little bit more motivation. Where are you riding to?
Minnesota.
All righty.
Going to Minnesota.
It's cold there.
I know it.
Yeah. That'd be a trip, wouldn't it?
Yeah.
It's opened up a whole new avenue for us as far as our therapeutic options. We've seen, especially from a cognition standpoint even, which is kind of blows me away, because having someone who has got dementia or some sort of an Alzheimer's type diagnosis, to get them in that Quadriciser just for 30 minutes or so, it's amazing to talk with them after they get out. But it seems to affect the brain as well. Like I say, I don't understand it, but the people tend to respond more appropriately to the questions that you ask them. The comments that they make are much more appropriate. But and then of course, I suppose the biggest thing that we've seen is the amount of active range of motion that we've gotten out of our stroke patients. We've got a paraplegic right now that loves being in it. In fact, he really wants to come down for therapy every single day. Now, this is a guy that did not want to come down and do the traditional therapies before, but since we've got him in the Quadriciser, he in fact, just yesterday he told me, he said, I like being in that, it makes my legs feel better, and he can't feel his legs.
This is Mr. Roy. He is 12 years post-stroke. Was it 12 years ago you had your stroke?
Yeah.
And then he had vascular surgery on his leg, and so he lost his ability to walk, and by his inactivity also lost the ability to raise his arm. And when I first met him in December, he couldn't really touch his shoulder, and now we're working on standing in the parallel bars and reaching up across his body with his arm, and a lot of it has to do with the Quadriciser.
Rick said, take your nose with your left finger. So I just reached it up there. I hadn't happened in 11 years.
You hadn't touched your nose in 11 years?
11 with my left hand.
My
goodness, that's something.
We saw a lot of improvement.
He said he scratched his nose for the first time in 11 years.
That's one of the things that I had him do. That's one of the things I had him do. As soon as we got him off of it, I said, now reach up and touch your nose. And I think it surprised him so much, that's all he's talked about since. Is when his family members come in and they converse with me, they say he still talks about reaching up, touching his nose. So, 'cause after a stroke, you know, a lot of times you're so uncoordinated on one side or the other. So it's a simple things that you and I take for granted is just huge.
How do you feel when you get done?
Well, I feel like I've accomplished something.
So from a therapy standpoint, it's a good tool if you have somebody who has an increase in spasticity. It helps to get more range of motion. And in the nursing home population, for contracture management, that can be huge. So that they're not getting contractures, which lead to bed sores and wounds and things that you really don't want to have. One of the nice things with the Quadriciser is that the patients who have hit a plateau or who are coming off traditional therapy services or ones that you may not consider as a traditional therapy candidate can actually be considered because it gives you an opportunity to kind of get rid of the plateau. It gives you that opportunity to give them something different, to stimulate their brain in a different way, to stimulate their muscles in a different way, and then take that and move it into something more traditional in therapy, standing balance, walking, transferring, in bed mobility, being able to put their shoes on and off. Just the response time. For a lot of time, you know, the lower level patients, you may just be looking at response time. How quickly do they follow something to the left or to the right? And you'll see faster improvements in their response time, which for Parkinson's patients, for patients who haven't been mobile, who might have limited communication, for swallowing dysphagia patients, they actually then are turning their head to the left and to the right, and those same neck muscles that are used for helping the head move are responsible for helping with swallowing. So you see an improvement in swallowing. So even the lowest level of patients you can reconsider for skilled therapy because you have an adjunct tool that allows you the ability to kind of get rid of the plateau. To have improvement in their range of motion and their ability to move and to have balance, and all of those things lead to a better quality of life, and that's what we want. I mean, I want my grandmother to have a good quality of life, and so if there's something out there that will help her not be stagnant and not curl up into a ball, then I want that opportunity for her.
Nothing's hit me like this.
Yeah, nothing's helped you like this.
Not a thing. It just, I feel like it's a lot of result without any pain. That's the best part. When I get through, I'm not wore out or anything like this.
Transfers have improved dramatically. I don't know if anybody else has said that. He used to be a max assist of 2, and now he's little Ann can pretty well handle him herself.
Initially, we weren't able to put his boot on him, but after the Quadriciser, we've been able to put his boot back on him, which has enabled him to be able to start walking again. So that is very exciting. Good. You ready? Left. Good.
Brings them to another level or another couple of levels. In fact, we've been able to keep patients longer because we're able to document progress. See, that's the biggest thing with keeping patients in therapy is being able to document progress. If you're not able to document that, you got to let them go. But with this, we're able to document, as long as we're able to document consistent progress, the patient gets to stay in therapy. It's actually increasing our workload for us, and that's what I like, because that's job security.